Well, I'll tell you, I read very carefully the ideas that came out of the review of this. You know, the WikiLeaks publication of John Podesta's emails hardly seems to be as egregious as some of the other things that Putin has done that should have been reactive early on. Look at the invasion and occupation of Crimea in eastern Ukraine, the shooting down of a Malaysian airliner in which innocents died, and of course, providing advanced surface-to-air missiles to Iran in violation of UN resolutions, and the Russian threats to Romania, Poland, and the Baltic states. Russian bombing campaign in Syria, in which thousands have died, and which some have described as a war crime. None of this got the reaction from Barack Obama that we've now seen over hacking into John Podesta's emails.
You know, well, we have to also wonder, too, sir, what the role of the United States is going to be with regards to Russia and Syria. And does our military finally get a little more involved there, since you've got a humanitarian crisis on the ground? I want to move on to something else, though, that I know is near and dear to your heart. And it's about letting our nation's heroes down. The VA, huge report on this, overprescribing opioids to returning soldiers for injuries and PTSD. The agency now struggling to provide rehab to these guys. Thousands of veterans are now addicted, Colonel North. What do you make of this, and why do we have such a crisis for our veterans right now?
Yeah, Cheryl, I was in a VA hospital yesterday, and I want to just put this problem in slightly broader context, because according to the National Institutes of Health, 20.5 million Americans aged 12 or over have substance abuse disorders, in other words, addiction. 2.2 million Americans are addicted to opioid pain relievers. Nearly 600,000 are addicted to heroin. Drug overdose is now the leading cause of accidental death in America, 55,000 last year alone, 20,000 of them from prescription pain relievers. And amazingly, it wasn't until 2012 that NIH decided to alert medical professionals to this epidemic. In 2013, U.S. military hospitals and the VA started to tighten prescription criteria. So, for example, they acknowledge that veterans are much more likely to abuse opioids than the average American because that's the drug they were given after they were wounded. And it's very easy to get hooked on these painkillers after combat injuries. Now we're seeing the results of that prolific use of painkillers, and it's the VA hospitals this week and afterwards that are now going to say, we've got to have a whole lot more rehab for these patients. The patients are no longer being given 100+ doses of these medications. But the problem is going to continue until we have sufficient rehab facilities, and that means VA is either going to have to build some, or the real fix, hire veterans first at the VA facilities, so the next VA secretary at least has a chance of succeeding. And number two, make sure that when a veteran can't get the kind of help he needs at a VA hospital, give him an ID card that's got a chip in it that says a service-connected disability. If you can't get treated at a VA facility, you get to go to any facility in America that will honor that ID card.
The private-public partnership for the VA, Colonel North, that Donald Trump, we believe that's going to be one of the first things on the agenda, along with we need a VA secretary. Colonel North, thank you so much. Really appreciate it. Happy New Year.
Happy New Year to you all. Well,
you want to be sure to tune into War Stories tomorrow. That starts at 8 p.m. Eastern Time, and again Sunday, 8 p.m. Eastern Time. That is right here on the Fox Business Network.